Good afternoon and welcome to the Assembly Committee on Commerce and Labor. Secretary, please take roll.
Assemblywoman Backus. Assemblyman Carter.
Present.
Assemblywoman Duran.
Here.
Assemblywoman Hardy. Here. Assemblywoman Howdigi. Assemblywoman Kasama. Here. Assemblywoman Monroe Moreno. Here. Assemblyman O'Neill. Here. Assemblywoman Torres. Here. Assemblyman Yeager. Here. Assemblyman Urick. Here. Chair Marzola.
And I am here. Can you please mark Vice Chair Howdigi present once she arrives? Welcome everyone here in Carson City, anyone joining us in Las Vegas and over the internet. Before we get started, I would like to go over a few housekeeping announcements. Please silence all of your electronic devices. If you wish to testify, please sign in at the table by the door. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. I expect courtesy and respect in all our interactions, even if we may not agree. Lastly, committee members will be using their laptops to view handouts and other documents. Please do not view this as a sign of disrespect or inattention. We are going to take our bills today out of order. We will start with Assembly Bill 158. This measure revises provisions relating to emergency medical services. And it is being presented by Assemblyman O'Neill. You can start when you're ready.
I'm glad to see everybody in such good cheer. It must have been a very happy St. Patty's Day lunch. But thank you, Chair, for taking us this morning. Good afternoon to Chair Marzola and members of the Assembly, Commerce and Labor. I've got to tell you, the view is different on this side. I'm P.K. O'Neill, Assembly District 40. I'm here today to represent and to introduce to you Assembly Bill 158, a bill dealing with Nevada joining the Emergency Medical Services Compact, which grants multi-state privilege to practice for emergency medical service personnel. Currently, there are 22 states, including Idaho and Utah, which are part of the EMS Compact, with over 200,000 compact providers in their database. Additionally, there are 7 states that have their membership pending currently. The compact facilitates the movement of licensed EMS personnel across state boundaries in the performance of their official duties by providing EMS professionals the privilege to practice in other compact states. The compact increases access to patient care, protects the public, reduces administrative burdens, and enhances emergency medical services systems in the United States. The EMS Compact also standardized state licensure requirements, mandates an FBI fingerprint background check for EMS personnel, establishes a national database for EMS personnel, creates a new mechanism for states to collaborate, investigation, and discipline in their across state borders. EMTs and medics are used in numerous ways to expand our medical services throughout Nevada, which we are so desperately in need of. I have with me today Jared Oscarson and Ray Mollers, who, may I say, flew in from North Carolina on a red eye and is taking a red eye back to North Carolina. So please be kind on the questioning, I think. But they are here to provide more background information, go through the legislation, and to show you the importance of this pending bill in front of you today. Chair, if I may, I'd like to allow both Mr. Oscarson and Mollers to take it from here.
You may start when you're ready. Please remember to state and spell your name for the record.
Jared Oscarson, Jaredoscarson. Thank you, Madam Chair, and the rest of the committee members for hearing this important piece of legislation. This is such an important tool to add to the toolbox for our state regulators around EMS. And it's an important tool because we've seen the shortages, we know the shortages. We have several border states to talk about it. It's Idaho and Utah where we have border towns and frontier communities that attract EMS providers from those states, and we also serve those states with some of our border agencies. So allowing the ability for those providers to work back and forth across those state lines is going to be extremely important as we go forward. I have worked across the state, everywhere from Vegas, Tonopah, Winnemucca, Reno. I've worked as an EMS provider in every one of those communities. And every time, the hardest part of recruiting in a frontier community is how long it takes to get licensure through the state or the city or the regulatory body. And it's by no fault of theirs, it's the tools. And this gives them another tool in their toolbox to expedite that process and put providers on the streets running ambulance calls and taking care of patients in those rural communities. This legislation is not designed to undermine or to change the ability or the regulatory purview of the state. It's to enhance their visibility of providers coming from other states, to be able to be part of a national database, and then to open up opportunities to recruit people to Nevada to work and to be a part of the infrastructure here, the critical infrastructure of EMS in Nevada. So thank you again, and I will turn it over to Mr. Mollers to go through the bill.
Good afternoon. My name is Ray Mollers, R-A-Y-M-O-L-L-E-R-S. I am currently the Executive Director for the Interstate Commission for the EMS Compact. I've been in that position about 18 months. Prior to that, I'm retired Department of Homeland Security, where I managed EMS there. The providers that are law enforcement first, but provide EMS care, such as Border Patrol, our Immigrations and Customs, Secret Service, Coast Guard, all of that. And I'm also a retired provider. I was a Special Forces medic, 22 years in the Army. I come today really to explain and answer any questions in support of this bill. For the state. It really is the state's decision if they want this or not. It's not something I want to sell to any state if it's not right for the state. It came about, the model legislation, which is almost word for word in the bill, came about from the Department of Homeland Security. When I was there, I was the contracting officer representative that brought the group of experts and subject matter experts and all of the voices together to write the model language. That model language really sets the requirements that essentially brings all states into agreement. So they are a baseline of acceptable requirements for EMS providers across state lines. So it has nothing to do with EM agencies or employers or the transport services or the platform, whether it be a helicopter or ground ambulance, whatever it is. This is strictly personnel licensure portability. So essentially it's connecting to you a network of currently 22 other states to either bring in, short of, if you read in the bill, there's a reference to EMACS, Emergency Management, the compact on that, where a governor declares an emergency and a lot of requirements and restrictions are lifted with that. So this would be prior to that situation, whether it be a shortage situation, whether it be day-to-day, this compact for those providers living on the border and working potentially in more than one state. You actually are in an area that could cover 3 states where a provider could have to maintain 3 licenses. If all 3 of those states were in the compact, they would only have to maintain 1. So if you think of it as like your driver's license, issued by one state, accepted by the other states that enter into that compact. Essentially, it's a contract agreeing to the terms that you can share that resource. So it's connecting you to that network. Nevada, in the bill, it states out the requirements for the state. Earlier today, we were walking through that, and everything is met. There is very little that the state would have to do. It could be implemented rather rapidly. Madam Chair and committee members, would you like me to walk through the bill, or would you rather present questions that you may have?
Please start by walking us through the bill first before
Sure.
questions.
So the first part of the bill, page 4 of the bill, is really where it starts. It's the purpose. It's to provide qualified EMS providers the opportunity to cross state lines. The second section defines out the terms used, very similar to a contract, to be on the same page. Section 3, I talked about the requirements for the state, and those are, you currently have to, the state would have to utilize National Registry of EMTs certification for initial licensure, which the state already does. Mechanism in place for receiving and investigating complaints that is already in place by the regulatory authority in the state and is enhanced by the coordinated database and the tools provided by the compact. Notifies the commission of any adverse action that is also done through the coordinated database. And then it mentions criminal background check, which the state already requires for licensure. And then section 4 talks about, it's really giving the authority, the states in this compact shall recognize that privilege of practice of an individual, and it lists out what has to be, what is looking. This is done through the coordinated database and available through a public lookup on a website. So the logic in that database is looking for a valid EMS license at the levels outlined in the compact. So it's EMT through paramedic. They have to be above the age of 18. They cannot be, their license can't be restricted in any way, and they have to be, work under supervision of a medical director. And then it walks through some exceptions. Section 5 goes through the conditions. They're very broad and not real defining, so that it allows, in the design of the model language, they were looking to make it as useful a tool as it could possibly be. So it talks about 5 conditions, the 5th one being in line with the rules of the Compact Commission. The other 4 are just scenarios in which some may be happening on a day-to-day today. Border providers may be crossing into another state, and that may be facilitated through agreements that have been made over the years. But this would give legal authority for this to occur. Section 6, I mentioned the EMAC compact. This legislation gives authority up to that point. Section 7 is where it supports our veterans, and it talks about facilitating faster licensure for our veterans that are transitioning. Section 8 really talks about really the sharing of information and protection of the public. It is done through the coordinated database, and that would be, it's something that the current members of the compact have realized over the last 5 years in which the compact has been active, has been that sharing authority to identify providers that may not be, they may be running from something from one state and trying to provide care in another. The coordinated database has assisted in identifying those personnel so that you can, one, the remote state can remove that privilege, and if it's removed from one state, it's removed from all states. And then it's up to the licensing authority. So the home state that issued that license that they are practicing under, utilizing that multi-state privilege, that home state, through the authority, can share the information with the remote state that they were practicing and can share that information with the home state, and they can take action on that licensure. They are the authority over that license. Section 10 talks about a commission. The state, 22 states now, there's 22 commissioners. It's generally been the regulatory state director, whatever their title, it varies state to state, has been the commissioner appointed by the state. They meet at least 2 to 3 times a year, once in person. Really what they're doing is setting the rules that further define how this functions and just managing the relationships between the states in this contract to share the resources. Section 11, coordinated database. The state of Nevada has a vendor for their license management system that has been the easiest and least cost to the state for connecting to the coordinated database. What it's doing is connecting the licensure data to the shared database that all states can utilize to look up a provider should they have the need. The rulemaking authority in Section 12, I mentioned that. That's a responsibility of the commission. That would be management of the website, management of the coordinated database, all of those rules. Sharing of information. Section 13, oversight, dispute. Really talks about sorry, I don't get into that section very often. Really, it works on how to manage disputes, at what authority, how does it get remedied. For an example I can think of, if a state is not compliant with the law, how do you manage that? It lines out if you were to have to come to the point where you remove their authority or remove them from the compact. Implementation, it talks about the 10th, I believe that's where 5 years ago when the 10th state signed the legislation, it became a compact. And the state has the authority or has the ability to withdraw from the compact. Honestly, I don't know that there's any more in the bill.
So, as you heard, this is pretty straight. Oh, sorry, Jared Oscarson. Apologies, Madam Chair. There's a lot of information in here, and it's pretty straightforward, and it follows that model verbiage that has been used in other states. A couple of the things that I really want to highlight is the national database. Right now, for licensing, we don't know when someone's coming from another state, what their history was there, what their discipline record was there, what their errors or omissions were there. This would give us that chance to have a full line of sight on who's coming in to provide care for patients in Nevada. And that's really important, especially as we are seeing high turnover in paramedics and EMTs right now, and when they're coming from other states, we just don't have that visibility. So I hate the word we're running from something, but could that be the case? And we don't want to not have line of sight on that. The other thing is I want to make sure it's extremely clear that this does not, if I'm a paramedic in Utah, it does not give me the freedom to freelance in Nevada. I still have to be a part of an agency working under a medical director in a licensed vehicle. So it's going to be, it's very clear that this is not, Jared can get a paramedic license in another state and come and practice. You know, I'm not going to put lights in my car and have a bag and run around running calls. I have to be part of an agency. I have to be part of a system to, again, not undermine any of the current public safety infrastructure. It's to bolster their visibility, their tools, and be able to bring in licensed, qualified personnel to provide care in Nevada. The exciting part of this is, you know, we're ready for this in Nevada. This has been coming. We've been trying to figure out how to license, how to attract people to the state. We're a growing state, and obviously paramedics and EMTs are an important part of the infrastructure of a community, and having enough providers to respond to calls, take calls. We saw during COVID where there were certain EMS agencies that were almost out of service because of COVID quarantine. They put whole shifts out of service, fire departments. This would have given us opportunity to bring in other teams and cover that under those emergency things prior to any of the emergency declarations from the governor's office, things like that. So this is a tool that can give agencies, whether it be a public or a private agency, the tools they need to work with their regulatory body to bring people in and get things done early and make sure we have the right resources for Nevada.
With that, Chair, I think we're, PK O'Neill, with that, Chair, we're ready for questioning from the committee. Thank you.
Thank you, Assemblyman, and thank you for the presentation. We will start with Vice Chair.
Thank you, Madam Chair, and thank you, Assemblyman, for bringing this bill. I'm usually a big fan of compacts because they allow for areas in which we're short on labor to be able to reach out and bring people in. And especially, I was carrying after our interim Commerce and Labor Committee a bill for service members for their portability, and I let my bill go because, you know, earlier this year the president signed HR 7939 that did just that allowed every active service member and their spouses to move their licenses freely across state lines as their orders get changed. And I think the only exception to his to that bill was, I think, law. I think every other license was covered under that. But I do have a question regarding the, I think it was, give me one second. It was the last section regarding how states could withdraw. And I just want to make sure I'm reading this correctly. So if a member state chooses to withdraw from the compact, all they have to do is repeal the compact that they put in statute. And then within 6 months of the repeal, they would be withdrawn from the compact, correct? So it can be done in as little as 6 months.
Ray Mullers, yes, ma'am. We have had one state that joined early that has withdrawn.
Oh, that was my next question. How many states have withdrawn? Is it only one?
Just one.
Okay.
It was in the Northeast, and they had no surrounding states in the compact. So, and it was early on. The compact hadn't proven itself to be useful. We hadn't been through COVID. The conditions might be different today, and especially if they had a neighboring state, they would most likely rejoin.
Okay.
Did that answer your question, ma'am?
It did, thank you. Thank you, Madam Chair.
Speaker?
Thank you so much, Madam Chair, and thank you for presenting. Thank you for traveling all the way here and back in the same day. That's quite a commitment. Just had a couple questions, really I guess just one question, but of the states that are in the compact now, has there been any litigation involved in any of the applications of the statutes, or because my understanding is these have to be adopted in basically the same form state by state. Have there been any issues that have arisen in other states that have adopted a compact?
Ray Mullers. Sir, there has not been any litigation. We did recently seek legal opinion to better define some of the terms, but that has been the only discussion because you're dealing with, 22 states. You could have 22 variations of interpretation. So that's better defining what has occurred over the last decade has been the only issue. Sir, did I answer your question? Thank you.
Committee members, any additional questions? Assemblywoman Monroe Moreno.
Thank you, Madam Chair. Could you tell me, you spoke about the background investigations that have to happen. What are those background investigations that currently happen for EMS? And can an EMS from another state lateral into departments here in the state of Nevada like they can for patrol officers and corrections?
Jared Oscarson, thank you for the question. So currently, both Clark County, Southern Nevada Health District, and the state of Nevada require a fingerprint background check on all paramedics and EMTs that provide care on an ambulance, licensed care. They would have the licensing endorsement. What that doesn't do is that doesn't check their history on their license for their background in providing care. So that gives them criminal history. It doesn't give them background into their paramedic career or their licensure. So that's done prior to them getting on an ambulance right now. And that's where we talked about this part of the compact. We already meet that requirement, which is one of the requirements you have to fulfill as part of the compact, is having a thorough background investigation for criminal.
Is there anything in current law or just standing operating procedures that prevents an EMS company here in the state of Nevada from doing a more thorough background check, talking with the company that a person is working for or had worked for to see what the record was with that company?
Jared Oscarson, not that I'm aware of.
Ray Mullers, ma'am, is your question, let me rephrase, can an employer or an EMS agency require above the minimum requirement of an FBI fingerprint background check?
Correct.
Yes, an employer can. Beyond requirements for employment are not covered in this legislation. It would only bring that privilege, so it would bring the person to the employer. The employer could have additional requirements of them to put them to work. Did I answer your question, ma'am?
And one more, if I can. Okay. My last question, I think, in Section 8, and subsection A, it says that the home state has the exclusive power to impose adverse actions against an individual. So what happens if the individual has an adverse situation in the remote state? Can they report that to the home state, and how would any of the other remote states find out about that adverse action?
Ray Mullers. Ma'am, the coordinated database is the mechanism by which it is shared, and it is expected that the state they have a responsibility to report it to the home state. The action that they can take is immediately they can remove that privilege, that multi-state privilege to practice, and it would be up to the home state, whoever licensed that individual, to take action on their license.
Thank you, Madam Chair.
Chair, if I may assist in that answer, PK O'Neill.
Go ahead.
Part of your first question, currently Nevada has a reciprocity on physicians, medical doctors licensing. And I know from being as a board member on a local hospital, we accept that part as they are a licensed physician. They've taken the national testing, the standards that we required. But we also, the hospital itself, will delve into a little further before we grant them authority or permissions to work within the hospital settings. And as to your second question on that same part in Section 8, if you go to B2, it reads, an individual currently subject to an adverse action in the home state shall not practice in any remote state without prior written authorization from both the home state and the remote state's EMS authority. So it does limit them, and this is one of the nice things about this is, as Mr. Oscarson has said, they're not allowed to run from one state to another, as we've had incidences in the past where a thorough background was not done, knowing not that they have a criminal background, but that they may be further to some litigation on their practices, their license, that does not surface up, but it'll be entered into this national database for us to give us the protection.
Thank you for that. My concern or my question was, if something happened in the remote state that they were working in, to make sure that that information was put into the database. So I understand about them having an adverse action and being disciplined in their home state, but my question was, if someone were here working in the state of Nevada and they came from Arizona or California, how would that be taken care of? But I think between the two of you, you answer that.
Ray Mullers. Ma'am, that has occurred, fortunately not very often, but just recently a Colorado provider was providing care in Texas. Texas identified an adverse action, took action, shared information that this legislation brings to table to be able to share that. And they were able to, so not only did Texas remove that privilege of practice in the state of Texas, but by sharing it, no other state there would be no longer a multi-state privilege of practice. And by sharing the information with the state of Colorado, Colorado took action on that license so that provider either gets remedial or whatever the stipulation is on what they did, or removal from their licensure that has taken place on a few occasions.
Thank you for that answer. Thank you, Madam Chair.
I have a quick question before we move on. If someone is removed from the compact due to disciplinary reasons, are they ever able to come back to the compact, or once they are taken out, it's forever?
Ray Mullers. Ma'am, so it's based off of a current licensure. So that multi-state privilege, let me give an example. A state may restrict a provider to their own state, so they initiate a removal of the privilege to practice. Say it's 1 year of supervision or something like that, and they just don't want to expose the other states to that. They can remove that. Some actions on licensure are time limited. So that's entered in the coordinated database, and it automatically comes back as long as that license remains valid. So there are mechanisms to bring it back, but it's really based off of the licensure of the home state. Did that answer your question, ma'am?
It did, thank you.
You're welcome.
Assemblywoman Torres.
Thank you, Madam Chair, and thank you for your presentation. Just two quick questions, so I'm just going to lump them in together for time's sake. My first question is whether or not the licensees would have to apply to be a part of that. I know some of our compacts, that's true. It seems like that would be true in this. So it'd be a specific type of license. My other question, too, is just what surrounding states are a part of that compact.
Ray Mullers. Ma'am, so it's different from some other healthcare licensure compacts where they issue a compact license like nursing does. This is more of a multi-state privilege that's granted through a valid license in a compact state. So like your driver's license issued by the state of Nevada is accepted in the other states, and that's facilitated through a compact. Your second part to your question, I'm sorry, could you restate that part? Oh, Idaho and Utah, ma'am. There is current legislation in 3 other states, ma'am.
And just one quick follow-up, if I may. And is like the requirements of this comparable to the current requirements that we have within the state of Nevada for EMT licensing?
Jared Oscarson. So the state of Nevada and Southern Nevada Health District both have meet the requirements of the compact. So we're already doing most of these things outside of the coordinated database. So that, and then, it would simplify our kind of reciprocity and things like that in the state. So we are currently doing the background checks, all those kind of things that are required, National Registry. Those are all part of the state already.
Assemblywoman Backus.
Thank you, Madam Chair. My question falls under, it is of the compact, section 10, and it pertains to L, the qualified immunity, defense, and indemnification. And everywhere else, I know member state is clearly defined, but this qualified immunity provides that it extends to the members, officers, executive director, employees, and representatives of the commission being immune from suit arising from a variety of circumstances. And I was curious, how broad is that intended to be? Because at the beginning of it, it clearly states that this is not to be construed as a waiver of sovereign immunity, but like in a state in Nevada, we do have a limited waiver of our sovereign immunity from suit when a suit is brought against our state. And so I was kind of a little confused by that, and I was curious how broad that would extend.
Ray Mullers, thank you for your question. The commission is actually dealing with that now. It is a question that they are asking their legal advisors whether they're trying to determine whether they need a directors and officers insurance policy. I believe that discussion going on now is the majority of the commissioners are state government officials. Therefore, it would be very similar to their role in a commissioner position as their state regulatory role. And I'm not sure I'm answering your question, ma'am.
Madam Chair, I'd be happy to clarify. I guess what I'm going at is there could be a situation, unforeseen circumstances, where maybe a licensee who's in the state of Nevada is involved in a situation that maybe they could be working for one of our government like ambulance providers. In that situation, I was trying to seek whether or not this qualified immunity was intended to extend to the actual licensee and potentially member state. I mean, that's kind of a weird circumstance that I kind of thought this may be trying to extend to, just because members didn't include that member state, and there was a lot of people being included in that.
Ray Mullers, thank you for the clarification. I am not an attorney, therefore, I believe that the intent of the legislative language is to cover the commissioners in their actions over creating rules and the management of the compact and the commission activities. It does not, in my opinion, extend to those afforded the multi-state privilege. Did that answer your question, ma'am?
It does. I'm taking it. The answer was pretty much no, it wouldn't extend to the situation that I provided.
Correct.
So I'm happy with that. And then, Madam Chair, if I could just ask one other question. It was interesting because our majority leader kind of indicated what the federal law was with respect to veterans. And sometimes I know with getting licensure in one state may be a lot easier than another state. And so I didn't know with EMS, it's an area that I'm just not familiar with. But as an attorney, I'm very familiar with certain states. I know which states are the easier states to get a bar license. And so I was curious, have you been seeing like anyone that is utilizing like a certain state to get easier licensure and then get into the compact to be able to work in another state? I was just curious about that.
Ray Mullers, thank you for your question, and is a concern of all the states. We have not seen that. The providers, this would be my opinion, the providers are maintaining their license generally where they live. The ones utilizing the privilege more across multiple states would be more in a flight paramedic situation where they could work for a provider agency that provides care in many states. They're an authorized EMS authority in many states. They may, like you've heard of traveling nurses, they may be like a traveling paramedic type situation where they're providing care in multiple states. And this would allow them to just maintain one license. Now, one part that I will point out is because this does not do anything for EMS agencies and employers could have, or the state could put a requirement if they're providing care in our state for more than 90 days. I'm just using an example, there, that you would need to get a state license from Nevada.
Madam Chair, if I have some follow-up for that. Jared Oscarson, apologies. This requires the National Registry, which is a standardized test that everyone has to take. So when we talk about an easier pathway, sometimes the easier pathway is the time of licensure, and that would be the only easy way to get around that. The test is the same across all of the compact states, that they have to take the National Registry test, which is like the nursing standardized test, medical boards, things like that. It's the equivalent of that for paramedics and EMTs. So that is still the required standard, and everyone has to have that to come into the compact as a state for initial licensure.
Assemblywoman Hardy.
Thank you, Chair, and thank you for being here and presenting this bill. So my question is just about the database, and you may have covered this, but just to clarify it. So who actually is putting the information into the database in each state?
Ray Mullers, thank you for the question. So the National Registry of VMTs is the provider. They purchased the nurses database and reformatted it to be EMS-centric. The state's license management system feeds into, generally on a 24-hour basis, so anything that changes today, tomorrow will be reflective, some of it's immediate, will be reflected in the coordinated database. So it's just reflecting what the state's submitting to the coordinated database. The data is all owned by the state. It's in their license management. They're just sharing certain elements of it that facilitate the privilege to practice, the determination for the privilege to practice. Did that answer your question, ma'am?
Vice Chair.
Thank you, Madam Chair, for allowing me another round of questions. And I wanted to make sure I understood the answer to my colleague's question, right? I admire her legal mind, and I just needed a little more simplified for me. So if a technician was liable for something, the immunity clause protects the compact, but that technician and the company that he works for can still be found liable.
Ray Mullers, yes, this affords no protection for the EMS agencies or the provider.
Okay, perfect. And then my last question, I was trying to look through my notes when I asked my first round of questions because I know it's in here, but I can't find it right now. If a member state makes changes to the compact, how does that impact Nevada if Nevada were to join the compact?
Ray Mullers, so that would be a question of, in the rules of the commission, that the commission utilizes, they would determine if a state was not compliant. For example, legislation changes and it greatly, so I mentioned this is kind of a contract. If they change their legislation to greatly, they require an additional requirement that's different from the other states. That would basically disqualify, I'm going to simplify it. They would be disqualified and there would be a process that they would either have to correct that or they would be removed from the compact. Did I answer your question, ma'am?
Committee members, any additional questions? I don't see any, so we will open up testimony in support. Is there anyone here in Carson City who would like to testify in support of Assembly Bill 158? You may begin when you're ready.
Thank you, Madam Chair. For the record, Tom Clark. I'm here on behalf of MedX Air 1. Jacob Dahlstra is on the phone line, so he'll put in his 2 minutes here in a second, but I wanted to get on the record that MedX Air 1 very much supports the compact. It will definitely help in the recruitment and retention of paramedics, especially in rural Nevada where they operate. I'll put on my other hat. I also represent the Board of Medical Examiners. Their legislative subcommittee did vote in support of this particular compact. They have had the physicians compact since 2015, and while it's a little bit different, it's pretty much the same in that it opens up the doors for us to bring doctors in from other states. And we have a problem across the board in the healthcare industry as far as providers are concerned. So anything we can do to open that up is great. Thank you, Chair.
Thank you. You may begin when you're ready.
Good afternoon, Madam Chair and committee members. For the record, my name is Matt Brown, M-A-T-T-B-R-W-N. I'm a director of rural EMS for Remsa Health and CareFlight in Reno. I'm here today to ask you all to support AB 158. EMS staffing has been in crisis for a number of years now. Even before COVID-19, many EMS agencies have been very challenged with putting ambulances and keeping adequately staffed personnel on the streets. Excuse me. During COVID-19 and even after, shortages have only become worse, and most EM agencies within Nevada and beyond are in a perpetual state of critical staffing shortages. AB 158 would give EMS providers a tool in which they can quickly and efficiently add EMS staff to their rosters in times of need without having to wait for several weeks or more to get providers licensed through the state EMS system, which is perpetually backlogged at this point. AB 158 gives EMS agency a means to help keep EMTs and paramedics in ambulances and available to provide emergency medical services to the public. EMS has proven itself time and time again to be an essential public service, especially in the last few years. But we need your help and support and give us the ability to continue to provide our essential services, and we cannot do that without EMS personnel. AB 158 gives us another tool to help maintain adequate staffing levels so we can meet our obligations to the public who rely on us. Thank you very much for your time and consideration.
And thank you for your testimony. Is there anyone else here in Carson City wishing to testify in support of Assembly Bill 158? I don't see anyone walking up. Is there anyone in Las Vegas wishing to testify in support? Broadcasting, is there anyone on the line?
Callers, if you'd like to testify in support of Assembly Bill 158, please press star 9 now to take your place in the queue.
Good afternoon. Can you hear me?
We can.
Okay, hi. Good afternoon, Chair Marzola, Vice Chair Hadagi, and members of the committee. On behalf of the United States Department of Defense and military families, I'm writing to express strong, I'm testifying to express strong support for the policy addressed in Assembly Bill 158. My name is Kelly Mae Douglas. I work for the Department of Defense State Liaison Office. state policies that enacting interstate licensure compacts, such as the EMS compact, relieves one of the many stressors of frequent military moves by enabling military spouses to transfer their licenses more quickly across state lines and obtain employment as soon as they relocate to a new state. These policies facilitate greater career sustainability for military spouses, improving their family's financial security and overall resilience. I do want to make a couple comments about the federal law. I mentioned, I heard that there was mention about the new federal law that was signed by the president in January within the Veterans Auto and Educational Improvement Act. Just to clarify, there's two provisions of that law. The first one does provide for that streamlined endorsement, but there's a second provision that does give precedence to any occupations that do have an enacted compact in that state. So if a service member or spouse came into Nevada with from a state that is a member of the EMS compact currently, and Nevada was part of that, the EMS compact, that would take precedence over Nevada's requirement to acknowledge or immediately issue a license. So I just wanted to clarify that. Additionally, interstate compacts benefit not only active duty military members and their spouses, but unlike the federal law that was just signed, they also apply to all eligible professionals, to include members of the reserve, Guard, veterans, and civilians. By enacting the EMS compact policy, Nevada would have the opportunity to increase its healthcare workforce available to serve the local community while also supporting military families. Thank you.
Thank you for your testimony. Broadcasting, is there anyone else on the line?
Callers, if you'd like to testify in support of Assembly Bill 158, please press star 9 now to take your place in the queue. Chair, there are no more callers in support at this time.
Thank you. We will move on to opposition. Is there anyone here in Carson City wishing to testify in opposition to Assembly Bill 158? I don't see anyone walking up. Is there anyone in Las Vegas? Broadcasting, is there anyone on the line wishing to testify in opposition to Assembly Bill 158?
If you'd like to testify in opposition to Assembly Bill 158, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone here in Carson City wishing to testify in a neutral position to Assembly Bill 158? I don't see anyone. Is there anyone in Las Vegas? I don't see anyone. Broadcasting, is there anyone on the line?
If you'd like to testify in neutral for Assembly Bill 158, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you. Assemblyman, did you want to give some final remarks?
Never give a chance to an Irishman to say a little more. Chair and committee members, I just want to thank you for this time and stress to you, this bill is necessary for the state. We have a shortage. I should just say ditto. We have a shortage. You name the medical service provider, we have a shortage in it. It covers the licensing, it covers protection. We are sure that we have proper people working here that we're able to recruit and bring into this state. And I ask for your consideration and passage of this bill. And thank you for this time.
Thank you, and thank you again for your presentation and bringing this bill forward. With that, I will close the hearing on Assembly Bill 158. 1 minute recess.
Good afternoon, Assemblywoman. We will now open the hearing on Assembly Bill 147. Chair, when you're ready.
Thank you, Vice Chair and members of the committee. I'm Elaine Marzola, representing Assembly District 21. Today I'm here to present Assembly Bill 147, which concerns dentistry. Joining me today is Eddie Ablesser from Tri-Strategies and Dr. Amy Abatan, who will provide some specific information on the bill and answer any questions that the committee may have. During the Legislative Interim Committee, I had the honor of serving in the Joint Interim Standing Committee on Commerce and Labor. We heard presentations on Nevada's healthcare workforce and how we can make healthcare more accessible for all our residents. In particular, we learned about expanding and modernizing oral health, doctors of dentistry, and some of the ancillary services that can assist our communities with access to care and quality of care and the convenience of accessing a trained and qualified dental professional in Nevada. Vice Chair, with your permission, I'm going to turn the presentation over to Mr. Ablesser to give you specific details of the bill and how it will benefit all Nevadans.
Thank you, Chair. Mr. Ablesser, when you're ready.
Thank you, Madam Vice Chair. For the record, Eddie Ablesser with Tri-Strategies on behalf of the Nevada Dental Association. I do want to sincerely thank Assemblywoman Marzola for working together from the interim committee on nuancing this language, which you'll see today is continually being nuanced, to really get to the heart and the value of what this bill brings to all Nevadans throughout the state. And really, the purpose of this committee in addressing the concerns of workforce shortages and access to care. And we believe from a teledentistry, vaccination, immunization, expansion of provider definition, and dental home, which I'll address in just a second, this gets to the heart of all those concerns. Nevada ranks 48th in the nation for overall health care according to the Commonwealth Fund from CDC. There's some rankings that we mentioned during the interim for your guidance, and we believe that just as one healthcare provider in the field, we're able to help address some of these poor rankings within the state to move the needle and provide more access and more treatment for individuals throughout the state. Doctors of dentistry, as we refer to our industry, are trained, qualified, and focused on helping Nevadans live healthier through interprofessional collaboration, integration of healthcare. We see the work that we do what they do from a oral health perspective in conjunction with our dental hygienist and dental therapist as being really important to the overall health of all individuals throughout the state, both young and old. We developed AB 147, the Modernization Dentistry Bill, to address ancillary oral health care services in a way that we believe are innovative and progressive and can increase the access and convenience to care through all Nevadans. We kept in mind many of our rural frontier communities and underrepresented communities in our urban areas of the state. To be more specific and walk you all through the bill, AB 147, Modernization of Dentistry, Part 1 deals with the provider of health care. And this is found in Section 1 of the bill. Section 1 of the bill simply adds dental hygienist and dental therapist to NRS 629.031. We believe this is an important provision opening up access and the inclusion of providers of health care with dental hygienists and dental therapists, which they are. And it will assist with our overall public health goals throughout the state for individuals' oral health. That's it for Section 1. Part 2, which is a little bit more robust, teledentistry. This was part of Senate Bill 391 of last session and had a lot of conversations throughout the interim and the previous session. Specifically about this section, we see in sections 2 through 14, sections 20 through 25, and sections 30 through 39 about teledentistry. It applies the distant site, originating site, and telehealth definitions ascribed in NRS 629. Teledentistry is used to diagnose, treat, educate, manage, and consult a patient, of course within appropriate conditions that a teledentistry can actually function. I have a dentist here from the Dental Association that can address that a little bit later. That dentist must be a licensed in state of Nevada. must establish a bona fide relationship with the client prior to establishing a teledentistry relationship. We believe this is extremely important for that ongoing care and ensuring that the individual is treated in an appropriate way by having that perhaps in-person oral screening before ongoing teledentistry. We do have an amendment that I'll address later that will change that a little bit on areas of emergent need and public health programs. This portion of the bill also addresses verification of patient contact information for provider, as well as informed consent, both written and verbal, and emergency procedures. I do want to inform the committee that we have been talking with Kat from Health Freedom Nevada on language to perhaps include written consent for minors in this teledentistry section. There's elements in this bill for HIPAA and recording requirements. We talk a little bit about the bill on the importance of referral care that is geographically accessible, which is really important for our rural and frontier communities to access providers of oral health care, and the ability for those providers to do ongoing care for emergencies as well. There's regulations that need to be created for prescriptions, maintenance of record, and coordination of care with other providers. We do have an amendment that I'll mention later about the education courses and continuing education course requirements for teledentistry. There's procedures of safely securing electronic storage of records. Those sections also include licensure requirements such as educational courses and 2 hours of CEs that the board will prescribe. There's an amendment, friendly amendment that addresses this as well. We talk about medical facilities noticing patients for the various providers through teledentistry, should they choose that while they're at their facility. We have a portion on DHHS oversight over teledentistry, and there's an issue about, or there's a section about professional limited liability insurance requirements in the bill. We are working with Prime Care Benefits Consulting. They brought up some nuanced language that might benefit that specific portion in Section 8 that can help it a little bit better. We don't have that language today, but hopefully in the near future. I have Dr. Amy Abatan to talk a little bit more about the value and the purpose of teledentistry for the state of Nevada.
Thank you, Chair, Vice Chair. My name is Dr. Amy Abatan. I'm a practicing general dentist in Reno, Nevada. I'm also a member of the Nevada Army National Guard. I'm a captain. I serve as a dentist there. Teledentistry is a wonderful tool for us to be able to use. It helps us to help patients assess in emergent situations whether further care is needed. As a class, our jobs really help us get immediate attention to patients. So one of the things that was noticed during the pandemic was that our profession was able to help keep a lot of people who would otherwise have been in the ER out of there. If they have a dental emergency, if they have pain, swelling, something that's keeping them out of their job for a day, we're able to keep them from needing to access elevated care. Teledentistry will allow us to do that further. If we are able to see a patient on a remote basis, we can keep them from needing to access elevated care, needing to use resources that could otherwise be directed in favor of care that your patients that need care better. We have a lot of things that we can look for and assess in teledentistry situations. So if we have video available, we are able to look for broken teeth, look for swelling, look for signs, symptoms, have patients indicate to us where things are hurting them. There are a lot of things that we can garner from a visual exam that allow us to render care, render an opinion, render whether they need emergent care or whether they can seek care in a little bit more delayed fashion. This has the potential to allow us to expand access to care, not only in the rural areas, but in a lot of the underserved urban areas as well. It can take a while to get in and establish with a general dentist, so this allows us to help people bridge the gap between. We still have a bona fide relationship with our patients prior to doing teledentistry, but it can help us see them more immediately. Thank you.
Thank you, Dr. Abatan.
Thank you, Dr. Abatan. Eddie Avlos for the record. I'm going to move to the third portion of our bill. I want to be clear, this portion is in the bill, and it's associated because it comes after teledentistry, but has nothing really to do with teledentistry. It's the immunization vaccination privileges in terms of scope and function of our oral medicine providers. And we believe that this section is important. In the state of Nevada, we see, based on, again, the CDC's Commonwealth Fund, 44th worst in the nation for vaccination administration for every 100,000 residents. We need more access for our citizens, for our individuals that can bring healthcare providers and give them the ability to seek immunization and vaccination if needed. So to walk through this section, I'm going to start. Nothing in this section mandates vaccination or immunizations in any way. This simply gives more access to our community through a highly trained, qualified healthcare provider to provide vaccination or immunization to a client or consumer if they need it. Sections 15 and through 19 of the bill and sections 24 through 25 of the bill address immunization and vaccination. The bill specifies that there will be a special license from the board to administer immunizations. We do have a friendly amendment that will clarify this a little bit more, but that special license from the board will be governed and dictated appropriately through regs from the board for a special procedure. We have doctors of oral medicine that do laser procedures, and that is a special license as well. They have to get a special license to do that. This is similar to that function. There will be approved courses from the board for the training. There will be separate special license. So the bill actually talks about a special separate license for immunization for influenza only. The amendment that you will see before you will strike that out. We believe that to simplify things, just one special license for the ability to do immunization or vaccination is sufficient. There's language in the bill that allows dental hygienist or dental therapist with the special endorsement who acts underneath the guidance of a doctor of dentistry to also help and assist in vaccination and immunization. Immunization must have a standing order from a doctor of dentistry, physician, PA, or APRN. Procedures on how to dispose of the contaminated equipment, plans for emergencies, reporting to the Board of Health on any severe reactions, following all CDC best practices, provide client with vaccine information statement. The bill has written informed consent. Every doctor of dentistry, dental hygienist, dental therapist must go through training on written informed consent. The bill has mandatory gained written informed consent, especially for our minors. There's a review of medical history, create a detailed record of the immunization, and forgive my misspelling of HIPAA, but HIPAA requirements as well. Furthermore, there are regulations for continuing education courses on immunization special endorsement and outlining unprofessional conduct in the administration of immunization. I'd like to ask Dr. Mark Funke to address some of the needs and why it's important to add this provision for doctors of dentistry in the state of Nevada.
Good evening. So, Madam Vice Chair, members of the committee, for the record, I'm Dr. Mark Funke, a practicing general dentist here in Carson City, Nevada. So as doctors of oral medicine, we are responsible for the general well-being of our patients, which involves such things as medical assessments, including any or all systemic diseases or conditions that the patient has. This includes accumulating all medications the patient is receiving, medications that we may potentially use, how they interact, what the physiological effects are, and how to handle the situation. It's important to understand, this bill in no way attempts to increase our scope of practice as healthcare providers, because it's already within our scope of practice. It's also important to understand, nowhere in this portion of the bill does it dictate that anybody is required to have to receive a vaccine. This is simply opening up more avenues with the decrease of, the lack of healthcare that we access that we have. So it still allows that person the right to choose if they want to receive a vaccine or not. So basically adds another, if you will, point of care, which will increase the public's access to life-saving care in a safe, effective, and convenient manner. I've got all I have.
Thank you. Thank you, Dr. Funke. Eddie Ablisser, for the record, that is the last part of the immunization vaccination portion, and our final portion of the bill is our dental home portion of the bill. Let me go back to dental home. If I could, I would have just written dental office. Dental office is basically what we mean when we say dental home. The American Dental Association refers to a dental home, or in the medical language, a primary care physician. It's a dental home. You all have a dental home. It's your primary dental office. In sections 26 and 29 of the bill, it stipulates that in certain situations, and that do exist in this state, if a school actually requires dental examinations, screenings, or assessments, that they may be done through teledentistry. The goal here is because there is a lack of providers and lack of care in some communities that they can't access those provisions. These could be done through programs. We've heard conversations around Head Start that might have requirements in order to check and make sure that there's any dental or oral lesions in the mouth. These are all parts of the bill that require that review. So only if this is the case, then we refer to the concept of a dental home or ongoing care or a virtual dental home if there is not one closely available. And that's what the provision of this section does. It establishes a dental home, which is basically continuously delivered care, comprehensive, coordinated, family-centered manner from a licensed dentist in the state of Nevada for that client. And a virtual dental home is a team of professionals who are connected virtually because there's not one closely located in some of our rural regions. And that's it for the notion of dental home. I do want to call up Dr. Dragon for a second, Dr. Funke, if you don't mind. Dr. Dragon has done work in the connection and coordination of care around dental home, and he's going to make a couple of comments around the significance of dental home and why that ongoing coordination of care is important for our citizens. Dr. Dragon.
Madam Vice Chair and members of the committee. Okay, Madam Vice Chair and members of the committee, for the record, my name is Richard Dragon. I represent the Nevada Dental Association and am also a practicing dentist in Gardnerville, Nevada. I wish to state that I am in support of AB 147 and wish to address sections 10, item 1, which states, except as otherwise provided in this subsection, a licensee must establish a bona fide relationship as defined by regulation of the board with a patient before providing services to the patient through teledentistry for emergent care and public health programs only. Specifically, emergent care is defined as treatment of pain, infection, or any intraoral or perioral conditions which presents immediate device to the patient's well-being and cannot be postponed. Public health programs is defined as any service or public health district or school district or Board of Dental Examiners approved programs. Excuse me. This section of AB 147 addresses access to care issues, which has generated questions from various individuals. There is a realization within the profession that a significant percentage of our population has varying degrees of dental coverage that they may not be aware of that they have it. Many of these individuals are perplexed on how their coverage can be utilized while also bearing concerns that their form of coverage may not be accepted at any given dental office. If a patient was allowed to call any dentist that were qualified as a teledentist to have some sort of offsite initial screening, that specific dentist could assess obvious needs and after a health history is reviewed, prescribe antibiotics and if needed, further suggest over-the-counter analgesics and how they should be used. In addition, the dentist could advise the patient on what they need to do and where they need to go next. In reality, there can only be two choices: referral to an emergency medical facility, which would be required for cases of extreme infections and/or injuries. The second choice would be referral to an actual dental office or dental home. Questions have been asked concerning the establishment of a dental coordinator to help these patients with obstacles they may face when trying to find a dental office/home. The American Dental Association provides information that defines what a community dental health coordinator is and the services they provide. CDHCs would come from the private sector, proving to be a win-win-win situation or outcome. By that I mean, 1, access to care has been addressed. 2, new patients are brought into a dental office, dental home. 3, reduction in dental emergent patients seeking treatment at medical emergency centers, taking the load off of those guys. So I want to thank you, Madam Vice Chair and committee members.
Thank you, Dr. Dragon. Members of the committee, we believe that these 4 provisions within the bill, Eddie Appleser for the record, these 4 provisions in the bill can really change some of the struggles that we're having in our urban and our rural communities, providing more access and convenience of care, and opening more pathways and doors for individuals to access some of the needed care. That's the extent of my prepared presentation. I do, Madam Vice Chair, have remarks on a proposed friendly amendment. If you would like me to present that first, prior to questions.
Yes, if we could start with the amendment, please.
Thank you. Madam Vice Chair, members of the Commerce and Labor Committee, Eddie Appleser for the record. Many of you have received a proposed friendly amendment. I do want to thank members of the insurance community, our friends at the Nevada Dental Hygienists Association, other members of Immunize Nevada, and other stakeholders that have come to me and talked to me about ways that we can make this bill better. In your possible friendly amendment that I'd like you to consider, there's 7 specific changes that we have identified right now that we think would make the bill significantly better. The first change is to add a new section in the bill. This was worked on with our insurers. The language would state, nothing precludes an organization for dental care or an administrator of a health dental plan that includes dental coverage from negotiating reimbursement rates for teledentistry with providers in their plan. We think this is a common sense language that ensures that providers and their insurers can work together on those rates. Nothing in this bill was intended to state that they should be on pair or parity with an in-office visit. We understand that many insurers have to negotiate those rates in other states as well. Number 2, Amendment 2, is deleting Section 7.4B. We believe that that section is a little confusing and does not really address some of the intent on teledentistry. And so we think by removing that and the notion of a professional judgment of the licensee on oral examination, we want things to be more specific and prescribed, and the board obviously has the ability to set that into regulation. The third amendment is in Section 9, line 21. There's the word teacher. Teacher exists in the collaboration real-time through teledentistry who is not a license pursuant to the chapter. Everyone else, every other function in that section is a professional in the healthcare field, and we felt that teacher probably didn't belong there, so we're removing the word teacher in the amendment. The fourth portion of this amendment is in Section 10.1. This is where it talks about establishing a bona fide relationship with a client prior to delivering teledentistry. 10.1 continues and says a licensee may establish such a relationship through teledentistry. We would like to add language that adds a comma after that and states for emergent care and public health programs only. We believe that a in-office, in-person visit is very important. An oral examination in person is very important. That in certain situations, without having that established relationship, there are situations that it cannot happen, and that's in emergent care or some of our public health programs where there is not a provider available for some of these clients that have needs. So the language would go, specifically, emergent care is defined as treatment of pain, infection, or any interoral or perioral condition which presents immediate demise to the patient's well-being and cannot be postponed. Public health programs is defined as any program which is administered by the Department of Health and Human Services or public health district or school district or board of dental examiners approved programs. We believe that those two caveats are appropriate exceptions to the establishment of a new patient through teledentistry. The Fifth Amendment in this friendly is the deletion of Section 16 completely. We believe, again, that in the immunization vaccination section of this bill and that special endorsement, that Section 15 is sufficient, that we don't need to have a secondary special endorsement just for influenza. We believe that one special endorsement is sufficient. And so following up with that, our sixth portion of the amendment removes or 16 from Section 17, 18, and 19, which references the section that was just previously deleted. Finally, the last part of our friendly amendment is in Section 21 of the bill, 21.2, subsection 2, specifically lines 23 and 24. This deals with the ongoing continuing education for teledentistry. Nothing in this was ever intended to force a dentist to have to go through trainings for teledentistry if they don't want to do teledentistry. It's a choice, it's an option. So we were not able to get this initially in the language, and so we believe by adding, in addition to satisfying the requirements of subsection 1, new language would state if an applicant for license to practice dental therapy or dentistry or any of its special branches, comma, we believe add who wishes to practice teledentistry, comma, must submit to the board proof that the applicant has completed the provisions of the continuing education. These are our friendly amendments that we would love for you to consider. We are supportive of these, and we thank our stakeholders in the community for working together to help refine this language to make it more appropriate. That's the extent of the presentation on amendments. Madam Vice Chair.
Thank you. Chair, are you ready for questions?
We are. Thank you, Vice Chair.
Okay, I'm going to start with Speaker Yeager.
Thank you so much, Madam Vice Chair. Chair, thank you for presenting, and I really appreciate the way you presented this bill. I thought it was a good mix of professionals coming in the middle, so well done on the presentation. First question I had isn't too much of a serious question, but I wanted to ask it's Dr. Dragon, right? Are those molars on your tie?
They are.
Okay. I couldn't tell from up here, but it looked like maybe that pattern was molars, and I don't know where you found that tie, but very, very appropriate day to wear it. So well done.
That was a wife thing. So
okay. Fantastic. And then, so the question I had about the substance of the bill relates to the amendment, and specifically the second recommendation in the amendment of the deletion of Section 7.4B. So if you go to page 6, that's where that language is found, and at the top it talks about things that a licensee shall not do if we're talking about teledentistry. And subsection A is provide treatment for any condition based solely on the results of an online questionnaire. That seems very reasonable to me. And then if we skip B for a second and go down to C, you can't engage in activity outside your scope of practice. That makes sense. I guess the question I have is, it seemed subsection B seemed to make a lot of sense to me to include in the bill, because it says essentially you can't provide services if in the professional judgment of the licensee or the relevant standard of care, those services should be provided in person. So I really kind of saw that as a consumer protection piece. And so I did hear you explain why, but I'm not sure that it made sense. So if you could just talk a little bit about the thought process behind eliminating that provision. Is that going to be provided somewhere else in terms of consumer protection?
Madam Vice Chair, Eddie Abelser for the record. Thank you, Madam Vice Chair, Speaker Yeager. When we read a licensee shall not, B, provide services through teledentistry, including without limitation, conducting an oral examination if the professional judgment of the licensee or according to the relevant standard of care, the services should be provided in person. The concern around that one, it seems like a double negative, right? There's confusing language, and I had multiple stakeholders reach out and ask me, what does it mean? And if we break down the notion of that, it basically stipulates that you can't do an oral examination through teledentistry, but you can if it's in your professional judgment or relevant standard of care. And when I went back to the Nevada Dental Association and the Nevada Dental Hygienists Association, what's relevant standard of care? It's very ambiguous. There is not a set definition to that. And so then the conversation is, well, if we keep this in here, we have to define relevant standard of care. So the logic on that was to go backwards in the bill to 5 when it talks about what is teledentistry intended to use for. Diagnose, treat, educate, care manage, self-manage of consultation with the client at these sites. And then we allowed, or we gave guidance to the board to create regulation on what those would look like. And we felt that that was sufficient in helping guide the function of a dentist through teledentistry. It just was a little confusing. Believe me, we went back and forth on this, but there was the confusion around what's professional judgment. In front of the board, if someone did something, they could say in their professional judgment, their oral examination met certain standards. What are those standards? It was just a little ambiguous, Mr. Speaker. Thank you.
Thank you, Speaker. I'm going to go to Assemblyman Carter next.
Thank you. And you probably did address this, but I just wanted to put it clearly. So this is not in any way, shape, or form empowering dentists or dental hygienists in the state of Nevada to practice outside of this jurisdiction through telehealth. And if that's true, is there any other way other than just taking the patient's word for it to prevent that from crossing state lines or jurisdiction for care?
Madam Vice Chair, Assemblyman Carter, thank you for the question. Eddie Ablisser for the record. It's my understanding that during the pandemic and during many executive orders given by both President then Trump and President Sisolak, there were Governor Sisolak, there were opportunities for professionals to work in cross-state methods. Currently, we don't have the ability for professionals through telehealth, teledentistry to meet care. I believe those executive orders have now been rescinded, and you have to be in the state that you're in order to practice. There are conversations in the future about compacts. You all hear about compacts. One of the conversations, I think, Assemblyman in this chamber is sponsoring a bill about compacts on the ability for people to practice both states. But that hasn't happened yet, and that can't happen yet. And so in this bill, you have to be a licensed dentist in this state to be able to provide that care. So let me also be clear, the person could be out of state, but licensed in Nevada to provide that care through teledentistry, but they have to have their dental home. They have to practice in Nevada. So they could have been on a conference, and I need a dentist and talk to them. Looks like my dentist want to jump in here.
Madam Vice Chair and Assemblyman Carter, basically there's a requirement here to take a health history. Health histories include addresses. So I'm not licensed to do this unless I've gone through the proper qualifications and I'm a licensed dentist within Nevada. That health history that they sign with their names, their birth dates, and their addresses is considered a legal document based on everything I've ever known in my entire life. So does that cover your question?
And Dr. Dragon, if I could just remind you to please state your name for the record when speaking.
Oh, I remembered to say your name. I forgot. Dragon. There you go. So.
Yeah, I believe so. Thank you very much.
Okay, thank you.
I will go to Assemblywoman Torres next.
Thank you, and I might actually have a couple of questions. Thank you for bringing the legislation and for the presentation. So my first question, I'm just going to go in order of the different sections that I have the questions. So on page 6 of legislation, section 9, looking at looking at the teledentistry and telehealth standards in here, I just want to know, like a quick confirmation that these are similar to and comparable to the other telehealth laws that we already have in the NRS.
Thank you, Madam Vice Chair. Eddie Avalos for the record. Assemblywoman Torres, yes, this bill was drafted, again, 2 years ago in consultation with Dr. Antonina Capurro, and she used a lot of the current language from telehealth, telemedicine, to help guide us in our teledentistry. Obviously, not everything is the same, so some things were omitted, and by our amendments, some things have to be changed, but it was very similar to telehealth.
Thank you. 2 more questions. So the next question is looking at page 13 of the bill, section 21. I see the language that we're adding regarding like the licensures. Does this include renewals for like the course, specifically the course in teledentistry? Because I'm wondering, like if for practicing dentists already, would they have to take this course?
Okay, so currently as it sits, thank you. Amy Abitian, Vice Chair, Assemblywoman Torres. Currently as it stands, 4 other adjunctive services that we are able to offer, for example, laser certification. That is a certification that we gain, we provide proof to our board, and then we are able to continually provide that care. If they have updated information that they want us to learn, they will advise us, but it is an ongoing thing. It can be decided whether this continuing education needs to be redone on a rolling basis with our renewals for our licenses, but as precedent, things like laser certification don't need to be renewed. It's something that we simply are able to continue doing.
Thank you. But I think my question is a little bit more targeted towards if you're practicing dentists like yourselves right now, would you have to take this course on the telehealth? Because I don't know. I don't know. It might be in here, but I didn't catch up.
Yes, it is in here. For the record, Amy Abitian, Vice Chair, Assemblywoman Torres, sorry. I'm new at this, I'm getting used to it, I apologize. Sorry, I missed, what's the question?
Dr. Abitian, if I may, Eddie Avalos for the record, Madam Vice Chair, Assemblywoman Torres, in section 2, section 21, subsection 2, new language, A and B has an or, and so either in the continuing education portion, you must take 2 hours prior to your renewal of license if you want to practice teledentistry, or for new students, they could do it through their course.
Thank you. I appreciate that. I was reading it wrong, so I appreciate the clarification. And my last question is on page 18, section 26. The language in here regarding school dentistry, it does say a public school that requires a child to receive a dental examination. As an educator myself, I'm not familiar with any schools that require that, so we might want to change that language that make available, because there are many schools that make those examinations available, and I think that might address some of the general public's concerns as well.
And you guys can go directly to the members. I'm going to make it easy.
Eddie Avalos for the record. Assemblywoman Torres, I think there's a good conversation that we are having with stakeholders around sections 26, 27, and 29 of this bill. These 3 sections, again, were designed in a way to recognize that some areas, like childcare facilities, we know that Boys and Girls Club, for example, has great programs that they give to their youth, and that there's an amazing delivery of services. We want to make sure, though, if there is an examination or a screening in any way, that child is not left and there's no coordination or wraparound services that happens in medical or behavioral health fields. In the oral health field, we want to make sure that that child, or in this situation, has a place to go, that home or that dental office, ongoing care. We will reach out to Health Freedom Nevada, who has some concerns about these specific, and I think there will be some good agreeable language in this area as well. Thank you.
Okay, I'm going to go to Assemblyman O'Neill next.
Thank you, Chair. I've got to say, I like the bill. I really do. We need to, as I said earlier, expand our services, particularly to rural Nevada. And I've got a couple questions, if I may, but I want to make sure I understand. This is purely voluntary. The immunization, the whole thing, it's purely voluntary in the dental part, correct? And with that, I really appreciate you working on, Chair Marzola, on some of the amendments to the bill. And if I understand correctly and follow up to Assemblywoman Torres's question, such programs, educational programs as Head Start, have federal requirements that before a child can enter in or utilize Head Start programs, they have to have a dental exam. Is that correct? Or am I close to being correct?
Eddie Allister, for the record, Assemblyman O'Neill, that is my understanding. Some of those federal programs have requirements. Our early intervention services, there's some requirements that ensure that we do a screening or evaluation of a child's mouth to make sure that they're healthy or their needs can be addressed.
And naturally, before any treatment, immunizations, vaccinations are administered to a juvenile, there is written requirements for their parent or legal guardian, correct?
Eddie Allister, for the record, Assemblyman O'Neill, in Section 18 of this bill, it stipulates that any child who does receive an immunization or vaccination from a oral medicine provider must have a written informed consent.
And one last question, which is really my question, Chair.
Absolutely. Go ahead, Assembly Member.
Thank you, Vice Chair. Section 30 of the hospitalizations requirements to perform certain acts. Could you explain that to me, please, in a little more, doing it in English instead of legalese for me, please?
Sure. Absolutely. Eddie Allister, for the record. Yeah, Section 30 of the bill is we believe in sort of that wraparound portion of care when we evaluated it. And one of the things that we have seen in some of our hospital facilities, medical facilities, is that oftentimes a client, a patient, has needs and doesn't know how to get those oral health needs addressed. All we're asking to is coordinate with those medical care facilities to ensure that they provide a way for that person to get perhaps teledentistry while they're at the site if there is not an oral health professional there. And it's coordinating with that facility to ensure that that opportunity exists.
May I ask a follow-up, Chair, to that, please?
Yes, Assembly Member.
Is that going to require a hospital emergency department to have an on-call dentist then 24/7?
Eddie Allister, for the record, Assemblyman O'Neill, I think that's a great point. I think actually it does the opposite, right? So now you don't have to have that emergency professional always there. You have the access through teledentistry in case there's that need, and a professional via teledentistry can diagnose and assume, check and make sure that something that is jeopardizing that patient gets checked out right away.
But it doesn't have to be at 2 o'clock in the morning? That's what I'm saying about on-call 24/7, even via teledentistry. I'm just trying to look at the hospital's requirements.
Eddie Allister, for the record, Assemblyman O'Neill, one of the values of our telehealth programs and now hopefully our teledentistry programs is that they're accessible 24/7, that someone somewhere is accessible 24/7. And as you and we all know, emergencies happen regardless of the time of the day. And so we want to make sure that our providers have that access to the consumers that need it.
I appreciate that someone somewhere part.
Thank you.
Thank you. Thank you, Chair, for the time. I appreciate it.
You're welcome, Assemblyman. I am going to go to Assemblyman Urick next.
Thank you, Vice Chair. And I want to really thank you all for coming and talking to me and trying to explain this. For some reason, I sit on some committees that have some controversial topics, and I think this is the one that has flooded my inbox the most, ironically. And you've done a great job of explaining, and I appreciate your indulgence of my questions. And I think even today, your presentation, as Speaker Yeager indicated, was very, very helpful. And I think the question that we addressed in my office, and I just want to clarify my understanding of it here, is it would make sense, right? I mean, of course, teledentistry. People are like, how do you fill a cavity over Zoom, right? Like that does not make sense. And so the requirement typically is that there would have to be a face-to-face meeting before a dentist with the relationship with their patient could continue to monitor and assess the situation, maybe update a prescription, something like that. But what we're allowing in this situation is that in situations, especially, I guess, to increase access in rural areas and some maybe where there's limitations on availability of providers, even in urban areas that might be underserved, is that in emergency situations, this could occur without having that relationship already established. And that would make sense. And you look at it's emergency, yes, go to the emergency room if you need to. But then there's this other section that allows it for public health programs. And it sounds like at that point, to address the specific question we had in my office, and I apologize, not everybody else is privy to the background on that, but that is why we would make the referral to a dental home so that the patient relationship could be established for necessary follow-up care. Can you just confirm that is the appropriate understanding?
Eddie Ablisser for the record. Assemblyman Yurick, that is 100% accurate. Thank you for so eloquently articulating that for the committee.
Members, any other questions? Okay, and Assemblymember Yurick asked mine, but I do want to make a statement. I just want to say thank you. I know that this isn't the first time that we've seen the bill, and I had concerns about some of the immunization components of it during our last legislative session, and I was able to go home during the interim and reach out to my dentist and have a conversation with him and other dentists as well that, you know, really made me understand the issue, and I'm very happy to see it here before us again because I think this will actually benefit our communities. So thank you. With that, I'm going to go to testimony and support. I'm going to start here in Carson City, then we will go to Las Vegas, then the phone line. So is there anyone in Carson City wishing to testify in support?
Madam Chair, for the record, my name is Karen Soley. I'm a registered dental hygienist here in the state of Nevada, and I practice in the Sparks area. I'm here representing the Nevada Dental Hygienists Association, and I want to thank you for bringing, Madam Chair, where are you? You're not up there anymore. There you are. I want to thank you for bringing this and sponsoring this bill forward. The Nevada Dental Hygienists Association has collaborated with the Nevada Dental Association on each of these identified areas of concern. We each brought forward mechanisms and ideas to advance oral health care for Nevadans. We had mutual agreement on multiple issues, and on some we respectfully disagreed with one another. Today, I'd like to briefly address the items in AB 147, which were contained verbatim in SB 391 of 2021 that was vetoed by the governor. It was passed bipartisan, though. Recognizing that dental therapists and dental hygienists are primary care providers in Nevada is necessary. This is necessary to recognize that hygienists are classified in the same category as dentists by the U.S. government and the Department of Labor. We are diagnosing and treating practitioners. This allows dental hygienists to be included in federal and state student loan repayment programs, which is helpful since the average dental hygiene student takes courses for 4 to 5 years. This could reduce the financial burden of secondary education and increase the number of dental hygienists. We are in a workforce shortage, as has already been discussed. Additionally, student loan repayment options could help encourage practitioners to work in our rural and underserved areas as well. Teledentistry. Language is needed to ensure that we protect the public, modernize dental care systems, and increase access to care. The Nevada Dental Hygienists Association has been advocating for this for 6 years, as it is a primary way to increase access to dental care in a wide variety of settings. We've learned through the pandemic that innovation is needed to increase utilization of our workforces and to expand the number of valuable contact points with licensed dental practitioners for the state of Nevada. And FYI, on the Nellis, there is a short video, it's about a 10-minute video that we provided It was created by one of our dental hygienists who actually has a mobile dental hygiene practice, and she utilizes teledentistry. So if you're interested, and you have 10 minutes to watch, it's worth it.
And Ms. Sully, we are going to ask that you wrap up your testimony.
Yes, ma'am.
I see that you have it in writing. If you'd like to give it to our committee secretary, he can distribute it to the committee members.
It has been submitted already. I do have 2 quick points, though.
Please.
On the amendments that were brought or suggested, we received those just this morning from the Nevada Dental Association. We are not in support of the recommended amendment that would make it for influenza only. However, the way it was presented to us, we misread it, and I do thank the presenters ahead of us in clarifying that. I think our other ones were pretty much in agreement with. I would also ask that in number 7 of the proposed possible amendments that were presented by Mr. Ablizer, that number 7, that final one, that we add the dental hygienist so that it would read, if an applicant for a license to practice dental hygiene, dental therapy, or dentistry, et cetera, that would just be a typographical inclusion.
Thank you, Ms. Sully.
Thank you.
Okay. When you're ready.
Thank you, Madam Chair. I was just along for the ride, actually, as a support for, in case there were questions about public health.
Thank you for being here. Okay, we are going to go down to is there anyone else in Carson City wishing to testify in support? Okay, seeing none, I'm going to go down to Las Vegas. Is there anyone in Las Vegas in support? BPS, could we please go to the phone line?
Callers, if you'd like to testify in support of Assembly Bill 147, please press star 9 now to take your place in the queue. Again, callers, if you'd like to testify in support of Assembly Bill 147, please press star 9 now to take your place in the queue. Chair, we have no callers in support at this time.
Thank you, BPS. We are now going to go to those in opposition. I'm going to go to Carson City first. Is there anyone in Carson City wishing to testify in opposition? Is there anyone in Las Vegas wishing to testify in opposition? Okay, seeing none, BPS, can we please go to the telephone line?
Callers, if you'd like to testify in opposition to Assembly Bill 147, please press star 9 now to take your place in the queue.
Hi, Madam Chair. Am I online? Hello?
So we can hear you.
Oh, great. Madam Chair, committee members, my name is Lydia Ruiz. I am calling in opposition to this bill. I was a military member. During my service, I had 3 or 4 years of extensive dentistry care, and not to get too much in the weeds, I did utilize emergency services at one point. And telemedicine, just listening to all these medical experts that were brought on here, the telemedicine seems like it might be an avenue more to get insurance, as far as to get paid for those by the insurance, more than the emergency services. If you're in emergency care, which I utilize every time I had something that I was unaware or maybe kind of in pain, I would call the dentist's office and they would tell me, yep, you need to go to the ER. That should not be qualified as a telemedicine or appointment. That's just the doctor saying, hey, yes, I saw you, and what you're having and experiencing is not normal. Go to the ER. Another part of this bill that I completely oppose is the vaccines being put into the dentistry. There are already vaccines available at grocery stores, pharmacies, retail stores, Walmart, Target, Albertsons. I mean, every single place in the corner of everywhere we can find avenues to get vaccines. And even on school sites in the beginning of the year, they have vaccine sites every time during the beginning. So I'm just wondering, why are we so focused on pushing and pushing? My kid's dentist here, there's a pediatrician, it's a Centennial Pediatrician Dentistry. They actually have kids go by themselves without their parents. They are encouraging parents to let their kids go by themselves to get their exams, teeth cleaning, appointments, all these things by themselves. That to me is frightening, to think that a child might be pursued by getting a token or getting some kind of reward or sticker or toy if you get a vaccine. You get a vaccine, you get another token. So that's super fearful for me as a parent, for dentist offices that go and encourage parents to wait in the lobby and children go by themselves. I completely oppose this bill. I think that there's a lot of work that can be done as somebody who had and to utilize.
Thank you, Ms. Reese.
Both military and
Ms. Reese, we're going to need you to
care.
wrap up your testimony in
Thank you.
opposition. We do have other callers to move on to. Thank you. BPS, could we please have the next caller brought online?
Good afternoon, Madam Chair and esteemed members of the committee. My name is Katanya Taylor, and I'm the Executive Director of Health Freedom Nevada. And I'm reading this testimony on behalf of my co-director, Kat Sienkiewicz. We are a nonpartisan grassroots all-volunteer organization representing approximately 5,000 Nevada families. And we serve as the Nevada affiliate for both Children's Health Defense and Stand for Health Freedom, national organizations whose missions align with ours. Our founding principles include the rights of every citizen and every parent or guardian in the case of a minor child to true and fully informed consent to any and all medical, pharmaceutical interventions, religious freedom, and parental rights in all personal health care decisions. We strongly oppose AB 147. Please consider making amendments to this bill that will specifically protect minor children in Nevada. Written parental consent for all dental, medical, and pharmaceutical treatment is absolutely necessary as it protects all parties legally, including the provider. Section 10(2)(d) needs to be updated to reflect this. Please also remove sections 26 through 29 entirely. The introduction of the concept of required dental examinations for school or daycare admittance is unacceptable. Though we recognize that the verbiage in this bill does not mandate these screenings, it certainly sets up the framework for a future mandate. It is simply bad public policy to deny an education to a child because of their medical status. We do, however, welcome discussions to considerably reword this section of the bill. Thank you very much.
Thank you for your testimony, Ms. Taylor. BPS, can we please move on to the next caller?
Thank you, Madam Vice Chair and the members of this committee. My name is Alida Benson, ALIDA-BENSON, Executive Director of the Nevada Republican Party, testifying in opposition to AB 147 on behalf of the Nevada Republican Party. AB 147 seems like a bill in search of a problem. First, it seeks to promote teledentistry, whereas most dental issues do require a hands-on examination. While education on dental best practices can certainly be conducted remotely, a teeth cleaning or root canal cannot. Rather than promoting teledentistry, why not give an incentive to Nevadans who take proactive care of their teeth? Perhaps a fee reduction or refund on taxes extracted from them by the government. A permanent sales tax holiday on toothpaste and floss. In sections 26 through 29, this bill again seeks to expand the role of the nanny state by imposing a dental exam requirement as a condition of admission into school. Again, rather than the government seeking to undermine the role of parents, why not reduce our burdensome taxes on families that choose to prioritize their children's dental health? The government has no place in your doctor's office. Finally, our third point of opposition to this bill is the allowance of a dentist, dental hygienist, or dental therapist to administer vaccines. It states in Section 18 that you would need to obtain the informed consent of the patient and review their medical history, except that dentists don't usually have access to the full medical history of a patient other than what is self-disclosed. Vaccines have trade-offs, especially for those with pre-existing conditions. And judging by the copious amount of billboards in our most populous county promoting vaccines, it does not appear that there is any shortage of locations to get them, as a previous caller noted. Let specialized doctors like dentists focus on what they do best and keep vaccines out of the dentist chair. On behalf of Republicans in the great state of Nevada, we oppose Assembly Bill 147. Thank you.
Thank you for your testimony, Ms. Benson. BPS, can we please move on to the next caller?
Hi, my name is Daphne Lee. I also oppose this bill as it is written currently without the amendments, echoing the sentiments of the callers before me. I definitely don't think that we should have required dental examinations. I have concerns about dentists doing vaccinations, and as long as it's amended to ensure that minors are protected. And I would like to note, as kind of a neutral add-on, that I'm sure that a lot of dentists will, if this were to pass, would be promoting the HPV vaccination. And I just want to let people know that that vaccination is currently in litigation. And for death, harm, and fraud, I personally know somebody whose daughter got an autoimmune disorder from this vaccination, which ended her collegiate athletic career. I think people need to learn more, especially our professionals, about the adverse events that are often not mentioned. And I just would encourage people to learn about these lawsuits. You can go on aboutlawsuits.com and read the complaints, and they're very educational. And otherwise, I would like to thank everyone who said that they were willing to work with the language and to amend it so that our concerns are addressed. I really appreciate that very much, and I appreciate the presenter and also the bill sponsor for their openness in the discussions. I think that's really important, and I appreciate it. Thank you so much.
Thank you for your testimony, Ms. Lee. BPS, do we have any other callers?
Thank you, Chairwoman and members of the committee. My name is Wiz Rizard, W-Z-R-O-U-Z-A-R-D. I'm actually calling as a private citizen, as a father, and a bill sponsor for bringing this bill forward. I think dentists play a pivotal role in our community, and it's great to hear conversations in regards to how we can maximize that. As a parent, I do have some concerns, and I will direct the bill sponsor and the presenter to page 6, section 9. I think those definitely should be reassessed. We definitely don't want to include teachers, people who don't have those qualifications to start meddling into the medical affairs of students here at Long Beach. On section 10, I understand, actually, I applaud you. You're the first to include unemancipated minor in your language. Thank you for respecting that. But I would encourage you to take a step further where it states that parents can be or need to be present, please mind, and provide consent. Okay, currently written, yes, the parent can be present, but if the child wants to receive the service, that dentist will only require that child to provide a verbal or a written consent as the patient. So I want to make sure we are protecting the vulnerable groups along these children who are not mentally capable of making informed decisions regarding medical treatment. Other than that, I think the bill is going in the right direction, and I appreciate the conversations and the insights and a lot of the opposition's perspective in helping strengthen this bill. Thank you very much. And for the record, I do oppose the bill. Should those changes be implemented, I can move forward to support. Thank you.
Thank you for your testimony, Mr. Bouchard. BPS, can we move on to the next caller?
Hello, Legislative Committee and everybody attending. My name is Leslie Quinn. I oppose AB 147. It's shocking that a dentistry topic of this importance would be in the Commerce and Labor Committee. I think most people would consider this a health and human services topic. However, this is more evidence that Nevadans' health is not the true concern of AB 147, but rather a financial business plan and agenda offering drive-through teledentistry and less in-person patient contact. I have a have-it-your-way dentistry care. AB 147 would allow dentists to provide patient care and in some cases diagnose via a patient's telephone image. But wait, there's more. Let's enhance your dental business and get the dentist, dental hygienist, and dental therapist trained to give immunization shots. This provides another sale vein for pharmaceutical companies to offer the latest hotshot immunizations to the numerous dentists throughout Nevada. Whatever happened to the Sunshine Act and pharmacy sales? Trusted dentists and staffs can now further perpetuate immunizations. We've seen many suddenly be affected by those hot shots. Do any and all dentists or their representatives, I leave you with these questions. Do any current Immunizations you would give your patient meet the following two criteria in preclinical animal trials. 1, do they show a protective benefit? 2, do they show no evidence of harm? If an immunization is not fully approved by the FDA and or has not met this 2 criteria, will it be put under emergency use authorization? If yes, where's their emergency now? Will dentists require new proposed injections to give informed consent? If yes, how will you do that without FDA approval and the clinical trial criteria? Will this not remove protections given by the 2005 PrEP Act and make you liable for injection damage? I strongly urge all legislators to vote no on AB 147. Thank you.
Thank you for your testimony, Ms. Quinn. BPS, do we have any other callers?
Good afternoon, Madam Vice Chair and members of the committee. My name is Sarah Yelowitz, and I live in Reno, Nevada. As a parent and a concerned citizen, I strongly oppose AB 147 for multiple reasons. Most importantly, a dentist's office is not at all the proper setting for giving vaccines. There is no shortage of access to vaccines in the community, so this is not only dangerous, but completely unnecessary as well. Please remove all references to vaccine administration entirely. That would be sections 15 through 19. Also, making sure that minor children are protected from unauthorized medical procedures is extremely important. Written parental consent for any treatment involving children is absolutely essential, and Section 10, Item 2D, needs to be updated to reflect that. Please also remove sections 26 through 29. Government-mandated medical procedures are never a good idea, and having required dental examinations for school or daycare admittance is unacceptable. In summary, dentists should never be giving vaccines. Proper informed consent should always be done in writing. And the last thing parents need right now is one more bureaucratic hurdle when they're trying to register their children for school. Please vote no on AB 147. Thank you.
Thank you for your testimony. BPS, next caller, please.
Callers, if you've recently joined and like to testify in opposition to Assembly Bill 147, please press star 9 to take your place in the queue. Chair, there are no more callers wishing to testify in opposition at this time.
Thank you, BPS. We are now going to go to neutral testimony. We're going to start in Carson City. So is there anyone in Carson City wishing to testify in neutral? Is there anyone in Las Vegas? BPS, can we please check the phone lines?
If you'd like to testify in neutral for Assembly Bill 147, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in neutral at this time.
Thank you so much, BPS. Chair
Chair,
Marzola, would you like to give any closing remarks?
Chair, we did have one person just join.
Oh, okay, perfect. If we could please go to them.
Hello, my name is Lorena Cardenas. That's Lorena, last name Cardenas. I'm a mother of 4, and I'm deeply troubled by the implications of this bill. So next week, my 8 and 6-year-olds have dentist appointments where they usually get very nervous, as most kids and adults do. You mean to tell me, Assemblywoman?
Hello, Ms. Cardenas. I'm so sorry, but we are currently in testimony in neutral. If your testimony is in opposition, we have closed that. Would you please mind sending in your remarks in writing, and we can include those in the record? Thank you.
This is a bad idea.
Thank you, BPS. Is there anyone else wishing to testify in neutral?
Chair, there are no more callers at this time.
Thank you so much, BPS. Chair Marzola, would you like to give any closing remarks?
Thank you, Vice Chair. Assembly Bill 147 truly is a bill about giving greater access to care. There's nothing in the bill that makes it mandatory, whether for the patient or the dentist. I appreciate everyone coming forward and support neutral, opposition. My door is always open. We can keep the conversation going. I appreciate everybody in the committee taking time today to listen, and everyone that has met with me as well.
Madam Vice Chair, Eddie Abelson for the record. I just want to thank the committee's time for entertaining our presentation and a conversation around this expansion of care for Nevada. I want to ensure the committee, Madam Vice Chair, that we are working with all stakeholders, members of Health Freedom Nevada, members of the insurance industry, ancillary healthcare professionals to continually refine this piece of legislation. I do want to let you all know that there were 3 points of concern from Health Freedom Nevada. We know that one of those points was addressed in the friendly amendment. The 2 other points we believe can be easily addressed through follow-up amendments, and hopefully those individuals that called in opposition can change to support the legislation once the amendment moves forward. Thank you.
Thank you. Okay, members, I will now close the hearing on Assembly Bill 147. We are going into a 1-minute recess. Thank you.
The committee will now come back to order. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Please remember, public comment is 2 minutes. Is anyone here in Carson City wishing to provide public comment? I don't see anyone. Is there anyone in Las Vegas? I don't see anyone. Broadcasting, is there anyone on the line wishing to provide public comment?
If you'd like to testify for public comment, please press star 9 now to take your place in the queue.
Hello, Madam Chair. This is Lydia Ruiz for the record. I'm thankful that the committee is looking into this. I definitely think all of Nevada needs to have access to dental care. It is so important to physical health. But I think this bill, there's a lot more work that needs to be done.
Ma'am, I have closed the bill hearing, but you are more than welcome to submit your comments in writing. Broadcast, is there anyone else on the line wishing to provide public comment?
Chair, there are no more callers at this time.
Thank you. Committee members, are there any questions and comments before we adjourn? I don't see any. This concludes our meeting for today. We are adjourned.